Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, guest host Allison Barlow, the director of the Center for American Indian Health at the Johns Hopkins Bloomberg School of Public Health, interviews Tribal Chairwoman Gwendina Lee Gatewood of the White Mountain Apache Tribe. The White Mountain Apache Tribe of more than 17,000 people has seen, by the beginning of August, more than 2,200 COVID infections and 34 deaths. From as many as 70 new cases a day, the number of new infections has dropped below 10. They speak about the tribe's effective response to this crisis and about hope for the future. Let's listen.
Hello, this is Allison Barlow, and I am so honored today to be with Tribal Chairwoman Gwendina Lee Gatewood from the White Mountain Apache Tribe. She has stood up an amazing effort to address COVID-19, and I just would like to have her introduce herself and explain her role with the tribe.
Good morning, everybody. From Arizona, my name is Gwendina Lee Gatewood. I am the first ever elected woman to the highest seat in the office of a tribal chairperson, and I am the tribal chairwoman for the White Mountain Apache Tribe. Good morning. Thank you for allowing me to be with you this morning.
I hope it's okay that I call you Gwendina. We've known each other for many years, and I really just want to go back to when the first case hit the tribe. What day was that? Where were you? What was that like?
It was election day. We were having our tribal elections, and it was April 1st. And I am the public information officer for my tribe. I remember getting the news from our Indian Health Service and our health department for the tribe. And I had to go make the announcement over the radio station. And it was really sad. And I remember it very vividly. And our election turnout was not that great because of the pending, awareness of COVID-19 in Arizona. And we now had it.
You now had it. I remember that day too. It was very frightening. And then what happened? How did it spread? What has been most difficult about the virus?
How it spread is our community, we're very social. Whenever there's birthday parties, family reunions, when people pass away, we have wakes, and the whole community, not most of them, come out and support the family. And it's a very close encircled space where everyone just sits with the dead and console one another. And when you're consoling someone, you're hugging them, you're crying and you're shaking hands. That has the opportunity for the virus to spread. And when you're, that close together, visiting is how it spread.
Yes, thank you. And I have observed that you're such a tight-knit community, and you did some very courageous things right at the beginning. You enacted policies. I think some things that maybe some of our audience members don't understand is that the White Mountain Apache Tribe, like all federally recognized tribes, is a sovereign nation, which gives you the ability to pass policies that may differ from state policies that are being passed. What were the types of policies that you passed right from the beginning?
Arizona at that time, it was still pretty relaxed. Everything was pretty wide open. But being that we are on our own reservation, we immediately went into declaring an emergency that allowed us to get additional state, local, federal resources available to us. And that deployed our emergency operations incident command team so that we could start getting a handle on the situation, and contact tracing immediately went into active mode. And we implemented curfew. We did many things like our cultural ceremonies, we had to postpone those. And a lot of families do a lot of ceremonies in the summer. And that affected that ability for them to have that ceremony. And churches, we postponed Sunday service. The stores, we had to implement 10 people or less, no public gathering. All the public facilities were closed off to people. And, children under 14 couldn't go in public areas. Wear your mask all the time, wash hands, social distancing. We even banned the sale of alcohol on our reservation. We just really went full force in all facets. Despite Arizona still being in a relaxed fashion, we were like, no, we need to do this now. And that's what we did.
It is amazing what you did. And I know that that the reservation borders other small towns. So to enact these types of policies, was it difficult to keep the people at home on the reservation and not leaving for other cities and towns?
Yes, it was very difficult. We have 3 major highways that go through our reservation. And when we asked for assistance, people didn't really understand the layout of our reservation. And they were like, can't you just close the roads? And I was like, no, you can't just close the roads, because we deal with the state of Arizona for the major highways, and we can't just close it. And some challenges we had in patrolling the people was we have about 22 officers for 1.6 million acres of land. And when you have just 22 officers for 13,000 plus people that live here, our tribal enrollment is 17,000 plus, but some of them live elsewhere. And that made it very difficult to patrol some of them, because when you get neighboring communities that say, my cousin got it and all she had was the sniffles, that sends a message to some of the people, oh, is that all? And then they just think, oh, this is okay, but it wasn't. And that education of letting them know had to stay consistent and steady, which is very unfortunate. When we had our first tribal member pass away from COVID, that was when the defining moment of, I better listen, that's what happened.
It's amazing. So the other thing about your community, you described 1.5 million acres. That is the size of the state of Delaware. And you have really one major grocery store in that huge span of land. So what did you do when people were asked to stay at home? How did you help people who may not have 2 weeks of food stored or may not have safe water to drink? What was done then? And I know it's been a very comprehensive approach that you've supported.
Fortunately, we've had many partners that came forward to donate truckloads of water. We had Santa Cruz County, who was very instrumental in delivering truckloads of produce that was distributed to the community. We also had, Johns Hopkins University. We had the neighboring county governments and the local cities, the mayors, they got together. And even the metropolitan Phoenix area, they got together and donated food so that we could get that out to the people. And the most important people that needed the food were the ones in quarantine, because we wanted them to stay put, like don't go anywhere. So we were catering to them, whatever they needed, as long as they stayed home.
Yes, and I know that really you almost operated a concierge service. I know that people were getting exactly what they needed, whether it was medicines or water or diapers. It just was an amazing effort that you've stood behind. The other thing that I think has been so impressive is that you've been guided a lot by looking at the data over the weeks to know when you could start reopening. For example, I know that a big source of your economy comes from the casino, and you've had to close that casino, and you did that to protect the people. But how are you now making decisions about how you can open up safely?
Since April 1 to now, we have been working so hard to flatten the curve. And last week, we get weekly reports done by Johns Hopkins University. and they have an epidemiologist that guides us through what is happening. And last week was the report that we were waiting for, showing that we had flattened the curve, but that doesn't mean we get complacent. We still stay vigilant in what we're doing. It has been a challenge, and we are still working on just making sure that the people are taken care of and working on getting that trend to go downward. And we depend heavily on that report because it shows us how we are doing in terms of positives, the age group. As long as things are heading on a downward trend, we're going to slowly open things back up, not all at once, but our economy has been affected, our recreational activities. A lot of people from Phoenix and metropolitan cities come here to enjoy our lakes, our rivers, streams, they go camping. We've shut all of that down. And now we're looking at slowly reopening the casino. How can we do that? What does our numbers look like? Can we trust that our tribal members will continue to remain vigilant? Can we continue to practice safety practices for our customers and patrons alike? Because safety is of utmost concern. But we also have to realize that the virus is here and we have a downward trajectory, but we also need to continue with our opportunity to get some economy back, because a lot of America's small town, mom and pop shops and what have you, the businesses have shut down. And this is all that we have. So if that's what's supporting our people, of course, we're going to have to go back to work and just continue to practice our safety measures while we are around this virus. And we just have to do that in a strategic and a smarter approach. Then it's the new norm. It is so different to look at something like that and seeing that our kids now can't socialize with one another. They're going to be at homeschool, and we live in a reservation where the internet services are not that great for a child to do a home study. That's a big challenge because our cell towers, our internet, it is really poor.
Yes, I've heard a lot about that from your community members, of the fear of going back to school online and how difficult that might be for some tribal members. On the other hand, you're such a resilient, incredibly strong people. What do you see in the future? What is your vision for after COVID? What has this done to strengthen the community? Has it brought new partners to you that will help you stand up stronger economic structures or better school systems or better broadband? What is your vision for the future?
Having gone through this, it has shown me the importance of family. This whole time that people have been home, I have been getting on the radio and telling them, don't just be home. Use this opportunity to improve your family relationships. Show your daughter how to change a tire, dad, while you're staying at home, so that she can equip herself with that skill that when she leaves home, she'll know that during this time, something positive came out of it. And for me, I worked with my children to teach them our language a lot better. And we practiced like we never practiced before, those positive that you have to look for. And children, in our culture, we say that they are our closest relatives ever. And they are the future leaders of tomorrow. So I want them to, one, be assured that they are in good hands and that we're doing everything to protect them. In fact, I want all of our people to know that, even those of you that are listening, to know that we have hope and we have faith in our community. They are a praying community. We are one with the Creator. And as long as we have that hope and faith that we can overcome the obstacles before us, it'll make us stronger. And that's what COVID has done on the positive side. And we've also learned that, you can't always be complacent. You have to always be aware of your surroundings and how you can protect your family. And the children, they're going back to school, and the time that they are going back to school and they're learning from home, this will be a time for moms and dads and the guardians out there to have a crucial role in making sure that they are developing educationally too. And I think this will give a new insight to parents, the role that teachers have in the classroom. So all of you teachers out there that are listening, I know some may feel like their role is taken for granted. Now I see that people are like, wow, teachers really have to give their all to help a child learn. And now I'm doing it as a parent to my child. It really sends a message of how much teachers really work hard and the sacrifice that they do in the 8 hours that they have our children so that they could be good citizens someday. And it really is true that it takes a village to raise a child. So all of you listeners out there, whatever role that you do in your work or career, thank you to your parents. Thank you to whoever was your mentor and your guidance person to allow you to serve in the way that you serve, whether you're a first responder, a teacher, a frontline worker, you're in the office. They're roles that complement each other in this great world that we live in. And you play a part in that. And I want our Apache people to know that they have a crucial role in this whole scheme of life that we are living in, and to know that they have a part to make things even better and contribute positively. And we do that day by day. And as long as we keep looking to being an optimist, things are going to be okay. And, this COVID has affected the mental health of my people. Why? Because things have been taken away from them that they were so used to. For example, going and consoling someone that has lost a loved one. They can't do that anymore. Even I can't do that anymore as a leader of my people, to go and show my love and compassion to somebody. Before I used to go to their homes, and now I can't. And that really makes me feel like, gosh, they must think I really don't care. But we have this virus amongst us that we have to be very careful. So I do phone calls. There's a new way of doing things. And I know that affects the mentality of our people. The ceremonies that the young girls were supposed to have, some of those girls think, geez, I'm not important. I can't even have this ceremony. And I have to tell them, you are important. Right now, we just have to deal with this virus. It's a postponement. It's not a definite no. So just know that it will happen. It just can't happen right now. Those types of things. And staying at home, I know they can't enjoy the outdoors. You can go outside of your yard, but going out into the mountains, rivers, and lakes has really affected some people. But I tell them, you have to talk about this, and you have to go take walks, go run, go jog, go do something with yourself so that you're not so focused on those things. That's what COVID has done. But you also make that into something positive, like I said earlier, by showing the children while you're with them at home how to change a tire, how to make bread, how to, the how-tos that you took for granted before, you can do that today.
Chairwoman Lee-Guitwood, thank you so much for your wisdom, for sharing from your community how you've dealt with this incredible virus in such an amazing way. We're so grateful.
Thank you. Thank you so much. And I appreciate you and everybody that's listening. Just know that you're all in my prayers, and we're doing this day by day, and keep up the good work in whatever it is that you are doing. And there's still goodness here, and we have to keep that shining brighter than the darker things, and it'll overcome. The light will overcome the dark.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.